I didn't put it on my intake form, but I have been having some thumb issue. I think it might be tendon related.
Are you capable? Do you mind if I feel it?
Yeah, sure.
Are you capable? That just hurts.
With pain, yeah.
With pain. Okay.
And I did get an X-ray done, and they didn't see any broken bones.
Any arthritis though in the joint?
No.
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 Okay, so then just overcontracture then probably.
Probably, yeah. And I did break my scaphoid in here a long time ago, but again, it didn't get rebroken. So, in my back, I also had some pretty intense pain, like mid left side majority. And I know I have some posture issues. I'd much rather like extend a chair back and just kind of sit there without any...
But you see how you're leaning from your hips? I need you to come back with your chest.
Like this.
And it probably hurts to do that.
It doesn't hurt, but if I stay like this for a while, it just feels uncomfortable.
So I'm going to place my hand on your back, okay?
Okay.
It's this. That.
Okay.
It's extremely stiff in there. You see how it just doesn't want to move?
Yeah.
Okay. All right, I'm going to feel. Is that okay? Anything else you want me to...
No, those are the big problem areas.
Just right here?
Yeah, it was...
Point to it for me.
This area right here.
Do you mind if I lift this shirt up?
No.
Let me just lift it up and see if I can't see it. Go ahead and point again.
This area right here?
Well, you, me, and everybody else on the planet has this problem. We frequently blow this side out. Like, I would say about 80% of the population right here. It's just the way the organs are situated and the way we lean. The way that our ergonomics is as a culture, this blows out very commonly.
Interesting.
Like it starts at grade school with the way the desks are, like everything. Turn, lift the shirt up again, cross your arms in front of me, yep. And I lean you back, yeah, right there. Okay, right here. All right, I'm gonna get started. On your back, face up.
Sure.
You got a lot of tension over here on the right. Feel all that. Not so much here on the left, except when we get, up into here. So this is where I'm going to be working up here.
Okay.
I'm going to go down here. Eventually I will get to your mid-back.
Sure.
Okay. Stop me if you have any questions, okay?
Okay. I'll just let the process roll out.
Pretty much. You just roll with it. Usually check this lower left. Most people have got like some edema down in here. It all depends on your history, what you went through, there we go. That shoulder I'm gonna have to needs the elbow. The knot is like that wide, that thick. It's just really deep in there. The whole reason why I'm working here is because I gotta lower the entire track.
Yeah.
I can't just lower one piece.
I do say the most common like tightness or stiffness I have is in like the shoulder neck region.
Oh, it is? Okay. I was just thinking here.
Yeah. I mean this has kind of gone away.
Okay.
Funny enough, once I started lifting again, because I did take a break after I...
Well, you got to get moving.
Yeah.
You can't stay still. Just moving will decrease pain. But it's a positive feedback loop. People feel pain, they stop moving. They feel pain, they stop moving. And then they never get anywhere.
I think a part of it, too, is after I got injured, I went straight back into it, and I was working through that injury imbalance, whatever.
Sometimes you can. Okay.
I can feel that one.
Yeah. Just got through that one because this is my target up here.
Okay.
So I just pushed it out of the way. Yep, so here we go. I'm going to pull that around.
You got strength.
Well, I got my whole body weight here. All right, here we go. You ready?
Mm-hmm.
There we go. Very good.
Always a good feeling.
What?
Always a good feeling.
Okay, good. All right. Chin back for me. A little bit. Back. There it goes. All right. Very nice, though. Nice adjustment. You left them for me, like you didn't pop any.
No, I sat that whole car ride just letting everything marinate.
Yeah, it all went. Feels like it could even go again. You know, it's kind of swollen here. As I take you back, I'm getting more of it. Gonna bend your knee. Perfect. Good. All right. Come on and sit up and face the window. Test out the neck, see if it's doing okay. I want you to test out the neck in the future. Just take it back. That's the trick. A lot of people like to yank it to the sides, but really just shoulders back and together. Like, that's the first thing you do. You just roll your shoulders back like this, neck back. That's the best stretch that you can do.
Okay.
A lot of people like to take it to the front, to the side.
I do like the roll.
Just this. If you can learn to do that, that will save you. Chest out, yeah, and then elbow back. Just your elbow right here. Yep, yeah, you get it. Yep, like that. Then relax, I got you now. And then lean away. Good. Which thumb is it? That one?
This one.
Okay. I'll get it in a second. There it goes. Now I know this one hurts, right?
Yeah, it'll still pop though.
Well, this is all I ever do. I don't like to really yank on them. Oh, I do feel the little bands in there. I don't feel, they're not happy with you. Okay, go ahead and go like that for me again. Wow, that thing just doesn't.
Yeah. Compared to the other thumb. What do they call it? Hitchhiker thumb?
Hitchhiker thumb, I think, is when it's always like that.
No.
The joint. Go ahead again. It's almost like the entire tendon here. It doesn't happen quickly. I have to sit here for probably another 10-20 minutes to get that thumb to come loose. But you can do it.
Wow.
But that hurts to go that way, right?
Yes, it does.
I didn't, Michael, you are trying so hard to swallow your pain right now.
Yeah.
So it's just really excruciating.
Yeah. As soon as it goes
Where? Point. Right at that joint?
Oh, I can feel it going down. It hurts like mostly right in here, and then I can feel it on the inside here as well. Ooh, wait. Yeah.
It's like, don't tell me that. I'm not hurting it. This is a ligament. Or / tendon. Okay. I ain't gonna hurt. It's not like a joint. A joint, I don't want to.
Yeah.
Okay, joint is a bone on bone. If it's bone on bone,
Yeah.
there's nothing much I can do for it. But any kind of contracted tendon, I can get rid of that. Okay, so just come in here and hold that down. I found it. It's kind of was all wiggled in with the other tendons here. Right here. You can do this to yourself. Hold that.
Yeah, that's tender.
You can do it to yourself.
Okay.
Take your knuckle.
Right here.
You're gonna give yourself a reverse handshake. Come in and hold it down on that bone. Right there. Hold it down.
Okay.
It's lifted.
Okay.
Okay, so it's taking up space and your thumb can't move.
Gotcha. So we're just pressing it back in.
I'm just pushing it back down. Right there.
Yep.
It's not supposed to be like that. There's a big
Okay.
gap.
Gotcha. Yep, that's it right there.
So you just push. Just hold.
Okay.
Relax. It definitely bends to here now. Okay.
Yep.
I know it hurts. But see, look, you feel the fluid coming out of it? See? Oh, there's a little bit more of it. There's more.
Yep.
There's more. I can feel the fluid. You're like, I know, I feel it too. Oh, there it goes, there it goes. Woo! If you never do it, you never get it.
Okay.
Okay? All right. Do you mind having your shirt off? And we're going to go
No.
face down. Don't worry about it. No, you don't have any. Just some moles. I mean, hopefully you get those checked out or watched, or you like a couple of them here. All right. Ooh, just so tight here, huh?
Mm-hmm.
It's pretty tight. So we're gonna try, okay?
Sure.
Take a deep breath in. Oh, yeah. Some. I know. That's probably the only one that's gonna move. Let's see. That hurt too much?
No, that was good.
That's just, oh, that's intense. Deep breath in again. Oh, yeah. That's probably all I'm gonna get. It's pretty tight. Deep breath in. Oh, yeah. Okay, that one's good. Yeah, I've got to loosen this up before I try to get more out of it. Or yeah, you will tense. You will spasm back up again. It's like massage, adjust, massage again. You know, keep going back and forth, back and forth. Doing okay?
Yep.
I know it's tense, but just keep breathing. As long as you haven't tapped out, or, you know, just tell me. So I keep going, all right? Breathe. So I'll work with you. That's it. Just keep breathing. Right there. Oh, that's bad on the left. Okay. If this is too much, you let me know, okay? Is it hurting your skin at all?
Nope.
Okay.
Trying to resist tensing up elsewhere.
I don't really care. It's just this spot right here, okay? This is all I'm worried about right here. This is your biggest problem. This whole left side. People are like, will you just let me relax? I'm like, no. I don't really care. As long as this is changing, I'm happy. It's not pleasant. It just isn't. So sure, you can tense up in your arms, your legs, whatever you gotta do to get through it. If you want, I can stop and we can just take a couple breaths and then start again.
Keep it going.
All right. I'm like, I would just say get it over with. Because you're almost done with this thingy. It's almost come out. Breathe for me. One big breath. And then out. Breathe out. That's it. Okay. Good. Whew. There we go. That looks much better. I don't know if it feels better, but it looks better from my point of view. So breathe. Whoa. Okay, I gotta put my leg up on the table, okay? And my leg is right here.
Sure.
Oh my god. I gotta talk to myself. It's like a balancing act for myself. There you go. There you go. All right. Got it down to one little corner here. That's it. All right.
Definitely looks a lot more painful in real life than in video. I see what you're saying now.
Yeah, it's not what you think. Everybody comes in here and they're like,
yeah, I know. Yeah, in real life it looks.
Are you sure about that? He's tough.
He is.
So I have to
tough.
be careful that I'm not,
Yes.
because he's just letting me do whatever, you know. And I'm like, okay, I can't like
Yes.
Let me back off. He's not going to tell me to back off, so I gotta, I gotta make a judgment call here.
Right.
Oh yeah.
Okay, too much. I can back off. I'm just gonna roll this down a little bit.
Sure.
Just to here, okay? Get some oil on a place I'll use later. Okay. Oh my goodness. How often do you work out?
Used to a lot more, but now I try to go 4 times a week.
Okay. I used to go 6 times a week. Now I'm only 4.
I used to go 6 times a week, twice a day.
Yeah. I'm like, what's this back been doing? Look at that. I'm using everything I get. Well, at least I had him first in the day. This arm over your head for me, just over your head like that. Yep. Go into the lat, in for spinatus.
Oh yeah, that's tender.
Here we go. Get it over with. Okay, down. Same thing, other side. Here we go. Oh my goodness. Whee! Oh. Ow.
Yep.
Hang out here. Oh, give this arm a break. All right, here we go. Breathe. I'm gonna drag this on down. Should be easier, but you never know. I might hit a pothole, okay? Ooh, there you go. Excellent. Arm behind your back. Perfect. Nothing there. Okay, we're gonna do the same thing other side. Maybe it's over here. No, yes, it's right here. Okay, here we go.
And let me see that hole it just made.
Oh.
There it is. Oh, yeah. Look at that. Nice, nice. Okay, whew, take a break. It's
Looks like a scraper.
dull. Okay,
Yeah.
it's not a knife. So that's all it is. You felt it a little bit there?
Yeah.
What we found out is that this petechiae is basically metabolic waste coming to the surface. Okay, there are inflammatory markers and inflammation down in deep into the muscle. We're pulling it up to the skin and letting the skin deal with it, okay?
Okay.
So it actually cuts down on the muscle soreness that you from all this work. We're bringing it to the surface. But the more you work out, the more crap will come out of people.
Mhm.
People that work out at the gym, the more stuff comes out.
That's a lot.
Whereas somebody that doesn't work out at the gym, only their injuries come out. There you go. Ooh, it's really bad over here. This is, woo.
So interesting. Yeah.
Sometimes people just come in for this,
Oh, wow.
and that's all they can take.
Yeah, where I went to school, all the athletes, they would go to like sports medicine.
Mm-hmm. Tuck your chin for me. Tuck.
Okay.
Yeah. Yep. You're good. And they would have this done.
They would have this, and they would have the cupping done.
Woo.
So you'd see people walking around with like polka dots and stuff.
But did you ever have it done?
I didn't. I always thought it was interesting though. I'm not really sure what it's used for.
The cupping?
Yeah.
It's to pull adhesions.
Okay.
You know, to get some of that inflammation out.
Okay.
You're separating the layers. They get
Gotcha.
glued like your thumb. Your thumb is a perfect analogy
Uh huh.
because you could feel how it was kind of webbed in there.
Yeah.
And then I kind of picked at it until it came apart. The cupping does that like real quick.
Gotcha.
Okay. And you're trying to straighten out fascia as much as you can. It gets clumped from injuries.
Gotcha.
It gets and the body puts down a piece of glue, and if you never rehab it properly, right, it's all over the place because your body freaks out and heals it. And it's not always perfectly aligned.
Gotcha.
It doesn't ever do as good a job as when you were made. And I'm like, woo-wee! All right. All right, I'll leave it alone. Let me check the other side real quick. I didn't feel anything over here. No, I'm not seeing anything over here. Okay. Skin pulling, okay?
Okay.
Not too many adhesions. Good.
I saw someone do that the first time the other day and blew my mind.
How are you feeling?
A little
Little
stiff.
sore? Okay. It's good that I stopped there then.
It's like an ink blot.
Oh yeah. Do you want to see your back? You want to take a picture
Sure.
of it? There it is.
Oh yeah.
All right.
So a
Now
lot
this-
more on that side, obviously.
This pink will go away
Mhm.
in about 30 minutes.
Okay.
These little markers here,
Mhm.
that's what stays for about 7 days.
Gotcha.
You can put aloe vera on if it feels itchy,
Okay.
to soothe the skin aspect of it, but the body eats away at it and dissolves it itself. Okay. Good. So just a gentle push, all right? Other side. Good. On your back for me. Bend both of your knees. Pubic symphysis, okay? 5, 4, 3, and that's it. That's all I got. And squeeze for me. Good. That's all I need to do. Come on and sit up. Face the windows. Doing all right?
Yep.
Now let's try to do the shoulders. That is what I really wanted.
Okay.
But yeah, you feel that?
Mhm.
That's gonna take a little bit of work. Hands on your hips for me. I think I got this one to move. Elbow back into my hand. You gotta see that the lats are. You gotta work on your lats a little bit here. Okay, I'm not gonna. We gotta work on being able to bring your scapula down.
Okay.
Yes.
Like that?
Uh-huh.
Okay. I think I'm trying to just like push back as opposed to like pull back.
Yeah, it's the whole shoulder. See, it went already.
Okay.
It just there just wasn't that loud clunk, but it went. That's all I need.
Okay.
So yeah, hands behind. Now, how does it feel
This is so cool.
if I was to just do this? That's more or less how it feels.
That's fine.
Okay, because here we go. Okay, take a deep breath in. All the way out. There it goes a little bit. And again. Excellent. Yeah, they're glued. They are glued. And again. Higher region. Good. All right. That's all I got for little me, okay? Is the butt on the ground?
Yes.
Roll down that way, a little higher. Get up in there. Yeah, right about there. I want your butt, on the ground.
Okay.
Because if it's not, you start to sprain the lower back. We don't want that. Your lower back's just fine.
Okay.
Okay? Just right here in this middle region.
Okay.
You understand you're shortening it.
Mhm.
It can't spasm this way. It spasms when you suddenly stretch it. Body's response is to cramp it. If you want to get off, you can.
Okay.
You're going to roll to the side. Roll to the side. Pick a side, any side.
Oh.
You're like, why did I do this? Just taking the blue pill. Knowledge is a weird thing, okay? Come on and push up. Just push up with your arms. Just your arms. Try not to use your back. There you go. You're like, why did I do this?
You're an old man.
It's okay. Once you get upright, you'll be okay. And you'll forget about it. There you go. Just take a couple breaths. This is what I was talking about in the very beginning.
Okay.
It's just like concrete. What's interesting is you're not hurting here, you're hurting down here.
Yeah.
Why? Because this is the part that's moving.
Okay.
This has never been injured except for whatever, like a lot of motion maybe, has swollen. So your body swells up down here. It's not worried about this part.
Gotcha.
This was an old injury, but it's also causing this to blow out.
Okay.
You need to be using all 12 vertebrae here, and you're only using half, maybe 6.
Okay.
These up here moved nicely, and these down here moved okay. You still need to work on this.
Okay.
That, I want you to go from where you are to here, and you gotta lift from here.
Okay.
See how your shoulder comes out of socket?
Mm-hmm.
Shoulder's in socket here. Look down at your shoulder now. Okay, shoulders slips forward that way.
Okay.
Any other questions for me?
No, I don't think so.